can start the countdown.
Yep.
This meeting is being recorded.
Okay. So, how many are there in the audience? Okay.
So 31.
They're joining in. Yeah, maybe I think people are waiting for us to go live. Let's maybe wait for a few more minutes. Yes. Okay. Arnab, if the count has gone past 35, I think we can get started. Maybe let people join, in their
I think so. Otherwise,
yeah,
we should not. It's 6:34 now in the computer club.
Sir, it is 33 now.
Start at 35.
Yeah, let's start 35 exactly.
Okay, sir. I will give you.
See, Jayantoda, one good part about the session is that, it's getting recorded, right? So, a lot of people who don't even belong to Sherwood, right? And they can get really benefited from the true, medical knowledge. That's the best part of it.
Right? Sure. Sir, 35% joined in participation link, and the questions and link in the chat box also.
Chat box, Arnab, I'm not able to see your link. I think I'll take the chat, questions at the end. Okay. And let's start with the session first of all. Okay, Arnab? Yeah.
Okay.
Great. Okay. We'll get started then. Good evening, everyone. It gives me a really big pleasure to invite you for such a wonderful and very timely session on COVID. Okay. What makes me, really, really ecstatic and happy is that we have got a very esteemed panel of doctors here, who will be able to tell you a lot about COVID. Those guys who have attended the session last time, they remember that and they understand that, this time, this COVID has turned into a big menace, right? The symptoms are different. The mortality is different. There are so many deaths. It has taken the literal world by, a very bad storm, right? And now that, vaccines are going to come out, still things are getting a bit better, but we have a long, long way to go. Okay. So I really welcome all of you to undergo this session wherein doctors will talk about, the queries which have been sent by the residents of Sherwood. They will tell you the whole story or the narration in as lucid format as possible, not really, very technology details or technical details. And that's how, we go from there. So just to introduce, we have got Dr. Jayanto Roy, who's the head of neurology in one of the very leading hospitals in Calcutta. Very, very prominent doctor. And he was the, main participant last time also. So he'll be leading the session this time too. We have got Dr. Priyanka Singh on the line as well, who's associated with Rabindranath Tagore and Narayana set of hospitals. Very competent doctor, in Sherwood. And we will be having two more doctors joining us very shortly. Okay. So I would request all of you, to make best use of this session. In case you have any question, please post on the chat window. Otherwise, we will get started with the core questions that, you guys have shared. That's number one. Number two is, that when this whole pandemic has come in, it has set the entire world into major depression, both during COVID time as well as the post-COVID time. And not only, COVID and post-COVID, people who are witnessing it, even they are not infected, they are under, I would say, a very bad phase, seeing this negativity all around, right? So how to take care of your mental health, how to remain upbeat. We have invited a very famous psychiatrist, a senior psychiatrist from Institute of Neurosciences, and he'll be able to talk about, how to remain upbeat and take care of your mental health. Finally, we are going to have a COVID warrior. This COVID warrior is a very senior IT professional, and unfortunately, he got infected, and so much so that he landed up into ICU, and he had some comorbidities, so his overall health suffered very badly, very, very badly. He spent 8 days in ICU, but came out victorious. Okay, so hear from him also, towards the end of the session. So with that, I will pass to Jayantoda, Dr. Priyanka Singh also to kickstart this session towards the question. Jayantoda, over to you. So Jayantoda, the first question that we have got from residents and also people outside Sherwood is that what makes this COVID mutant so dangerous and with such a high mortality?
Well, thank you, Ritesh, for this program. You are the main role to organize this, and I welcome every resident of Sherwood for this program today. And as explained by Ritesh already, we'll try to address those burning questions which is pertinent to this second wave of COVID, which is going through our country and different parts of the world. So coming back to the first question, the variant. Well, you have been getting the information from different sources that the new variant has come in India, and this Indian variant is also found in other countries, and the South African variant is coming to India. So these variants are basically the different mutants. And these virus, actually every virus, pathogenic virus, they go through some mutation process. It's not every mutation is harmful to human being. The mutation is a very natural thing, happens with the virus life cycle. But this COVID, the new variant, has become very dangerous because these new variants are more transmissible. The problem with the new variant is their transmission rate, infectivity rate is very high. So you have been probably noticing that this time in the second wave, we are seeing that if one person is affected in a family, then almost all are getting affected. It's not that everyone is having a serious disease, but everyone in household, everyone in the family are getting affected. So this is actually the problem with this variant is the infectivity part. There are some other variants which are known to cause more transmissions, but their pathogenic potential, immunogenic potentials also vary. But those variants are not commonly seen in Indian variant. The UK variant was known to cause more kind of pathogenicity in human beings. So this present Indian variant is notorious for its infectivity potential. That's important.
So can I add something?
Yes.
Hello, Jayanto. Yeah, basically, as you have already covered the main issue, the infectivity, but there are certain four more points we should discuss, I think. Number one, this is creating more complications and with resultant fatality rate increased. Number three, this is involving more younger age group compared to the classic variant, especially the pediatric age group and the most productive age group, that 18 to 44 years. And these are creating the problem in treatment, problem in disease control and all those things. And at the same time, this variant is sometimes escaping the usual diagnostic tests like RT-PCR and RAT, causing problem to the diagnosis. And at the same time, we also aware that all most, if not all vaccines are maybe less efficacious to this particular strain. So there will be a wholesome problem in prevention, treatment, and public health, everything.
Right.
This is a real danger.
And as you already mentioned, this vaccine thing, after the first wave, when vaccines came to the market, we started with elderly, then with below 6, above 45 with comorbidity. And if we see the trend now, we have seen patients in the same family where the oldest person who already got vaccinated did not have the serious disease, though got affected. But another younger person in the family has got more serious disease who actually didn't get vaccinated because he was below 45 and he was young and no comorbidity. So those were left behind for the vaccinations because we found they are more resistant or more immune to this disease. But unfortunately, the reverse happened this time. So this is exactly the reason we are demanding universal vaccination.
Exactly.
Because this below 45 age group, healthy young, and pediatric age group, adolescent age group, they are now outside the vaccine ambit. Though they have recently, between 18 to 45, the vaccination has been started. But there are very few percentage of this age group are getting vaccinated because of the non-availability. We all know that. We are running from pillar to post to get a slot. So faster we vaccinate them, better we are. So this is another very important issue probably we need to think about.
Before speaking something else, I just want to know, am I visible?
Yes, you are.
My camera is working? Okay, fine.
No,
I can't see myself. Okay. I can't see myself on the screen.
We can see you.
Okay, fine.
Yes, Ritesh. Proceed.
Sure. So I think that was really great, Jayantada, telling what is making this virus so dangerous. And like I think, you and Khetrodas said, it is not impacting a particular age group, but then anyone and everyone, literally, starting from 18 until 60 plus also are getting badly infected and unfortunately dying too. Okay. Thank you for, shedding light on that. So doctor, second question, that we got was, when people get moderately impacted versus seriously impacted in the initial days, right? What are the typical symptoms? And actually, I'll combine this with another question. When is the right time to see a doctor? Because many people have asked this question. So you get a flu, you get a temperature, you get a body ache, right? And COVID test takes some time. So when is the right time to see a doctor? What are the typical symptoms that one will see when you are moderate case and when you are serious case? That is something which multiple people have asked.
Well, I think it's a very important question. First of all, the COVID infection, those who are symptomatic, the common symptoms are usually fever, sore throat, cough, body ache. These are the usually symptoms to start with, but not limited to them. There are other atypical symptoms, sometimes start without them, which, does not arouse our suspicion that this could be COVID also. For example, stomach upset. So, and sometimes are just a headache or body ache. So there are many things which can happen with COVID. But one thing you have to remember that when you are in a pandemic, any symptom which has got any similarity with COVID should be considered as COVID unless proved otherwise. So in a pandemic situations, your first job is to exclude. It's not every fever is COVID. We know that. But in a pandemic situation, we must exclude that. And I would suggest that anybody having any symptom pertaining to this, they should consult a doctor. It not necessarily they have to go physically and see. These days we do online consultations, but a suggestion from a doctor and getting a test done should be done under a medical supervision, and their treatment part, staying at home, what medication they can do, they can take, how long they have to be confined at home, everything has to be supervised by a medical practitioner. So I would advise that any symptom should be reported to a doctor rather than ignoring them or denying them. Denial of a symptom doesn't usually help.
No.
Yeah.
I just wanted to add that means fever. If there is fever, that should be reported and that should be taken as COVID unless proved otherwise, isn't it?
Yes,
Absolutely.
fever is definitely one important symptom, but not that each and everyone gets fever. But
If there is fever, that is what I'm telling.
Many studies have shown that fever, cough, and sore throat.
Yes.
These three are probably the cardinal symptoms. And almost 90% of COVID patients will have at least one of them. It may be a one-day fever, but at least one of them. And 10% can have atypical symptoms other than these three. So any of them should be reported, should be consulted, and tested accordingly.
Even there are many atypical symptoms too. So even somebody is having fatigability, extreme weakness for 2 to 3 days, he or she should consult a doctor. Then the doctor will decide. That's a different. And what Javed is telling, that anybody is having fever, in today's context, initially it has to be taken as COVID, unless and until proved otherwise.
Correct.
That's the final thing. So any fever, you just consult.
Yes. Yes.
Okay, sure, Dr. Javed. I think thank you for shedding light on that. Right now, one thing which I've been asked by many people, in Sherwood, right? So there are so many, I would say, unproven treatments coming in the market, right? Somebody says that, eat this fruit, or somebody says that take this, medicine, and which is alternate medicine, not the mainstream line medicine, eat amla, or eat, this black pepper, and so forth. They are the, natural cures for it, right? But the challenge is, nobody has sort of seen the proven line of treatment in these areas, or no scientific evidence, right? So, what would you say about them, in terms of risk factor? Should people go and undertake it? If you can, just talk about that, please.
Ketro?
Yeah, I will tell that everybody should go by the evidence only. Okay, it's not about allopathy, Ayurvedic, homeopathy, these things. There is no such thing as allopathy. Actually, modern medicine, which is evidence-based, that is modern medicine. And one more thing you have to understand, that many things we need as trace elements, as micronutrients. They are required by our body, but in a very, very, very less quantity. If we take regularly in that thing in a larger quantity, that may create some problem. That may itself decrease our immunity. So we have to remember that. And everything has been advertised in the name of natural things. It is told that natural things means it doesn't have any adverse reaction. But it's not like that. Opium is a natural thing, but it has adverse effects. The snake venom is natural thing. This is not chemically synthesized thing, but those are having tremendous adverse effects. So we should consider these things. And even I'm telling, it's not that some medicines are today promoted by some companies and etc. etc. We should not jump into conclusion that as it is coming from the modern medicine, we should use it without discretion. Okay. So, and another thing is regarding the immuno booster. These days, this is a very happening term, but immunity cannot be achieved on a single day by taking something or gaining something. And immunity is a particular balance. You can say that under immunity is problematic and over immunity is also problematic. So, I just, in the context of COVID, I just want to emphasize on one particular thing, that in most of the complications of COVID is because of the cytokine storm, and that is because of the increased inflammatory response. So inflammation or immunity is a two-way sword, and that increased inflammatory response is because of altered immune response. So immunity is a thing which is a very balanced thing. We should not do this thing and that thing to alter that. And overnight, you cannot achieve robust immunity so that you can resist each and every infection and each and every disease. So we should go by the evidence-based practice. We should not go by what is told, what is advertised on the media like that.
Okay, yeah, I mean, very nicely told. I just add a couple of things. One is, since the COVID is almost 14 months old, so we have learned certain things from COVID. We have learned that this disease is at times very unpredictable. We have learned that. We have also learned that there are hardly any medication to treat COVID. There are few medications which have been proven to be effective against COVID. There are very few. There are so many came up in the market. They have been used extensively, but went off the market because new evidence came up and showed that they are not actually effective. So since, I mean, initially there was no treatment, practically, nobody was sure what works. So just like having a fire. So you put everything when your house is on fire. So, and then we learned that this doesn't work. So you leave that aside, leave this aside. So this is the way we progressed. And eventually we came up with this, understanding that there are three medications which probably works best in COVID in different scenarios. One is oxygen, one is steroid, and one is anticoagulation. So probably these three things are most important in our armamentarium to treat COVID. But it's not that each and every patient will require steroid. Using steroid at the right dose, at the right time, requires a medical consultation. Since people are using steroid, sometimes unfortunately with medical consultation, early enough, when it's not required, at a higher dose, which is also counterproductive. So these three medications are probably most effective treatment so far we got. And coming back to the immunity part, as Khetra has already mentioned, there is nothing called a ready-made immunity. Okay, immunity, there are two parts of our immune system. One is called innate immunity, with which we are born with. We have an immune system. And one is acquired immunity, which we acquire against different diseases when we are exposed to them. Someone who has got a chicken pox in childhood will get an immunity against chicken pox in the later part of the life. And this is the way we get vaccinated from childhood, to get antibodies against different diseases. So this COVID vaccine has been developed to give us an opportunity to develop antibodies against COVID. So if you get a COVID before a vaccine, you take a vaccine, you also get an antibody. But taking different immunomodulators, like anything with like immunohorlicks or immuno Coca-Cola or immuno pizza, they don't work actually. So this is it.
And nicely said, Jayantu, but I just want to clarify one single point, which may have on which there may have some confusion. Actually, if you get chicken pox, you get lifelong immunity. But if you get COVID, the immunity, the adaptive immunity, the acquired immunity is not lifelong. It stays for maximum 3 to 6 months. And that is the need why, even after having the COVID, you should take the vaccine. Of course, after a period of 3 months.
Yeah.
This is a burning question. Everybody is asking this. That's why I clarified it.
Yeah. My advice is whatever medicine you are taking, just take after a medical consultation with the doctor. Don't take any medicine, even vitamins. Vitamins or overdoses are also happening, and they are also causing many problems. So take all the medicines, whatever you are taking, immunobooster, after consulting a medical doctor. That is important. For immunity, you have to take balanced diet, exercise, stay positive, stay in a positive mood. That will increase your immunity.
Correct.
Correct. Sure.
Absolutely
Dr.
right.
Absolutely. I think very well said. We should not be really caught up with all these, new build up your immunity in 2 days and 5 days and drink this, Horlicks or Boost and, eat this olive oil and all, you should be fine to fight COVID. I think those are not the cases. I think very well said, doctors. Yes, thank you so much. So, one of the things which again came up with multiple residents and, doctors I've seen in my age group also, okay, many of, my colleagues and people in the society also, they got some serious degree of COVID. They were discharged also, which is actually a very good news after due treatment and, all that. But then, there were a lot of post-COVID complications, okay. Some of them actually really reported major weakness for almost a month and a half, number one. Some of them, said that they've got typhoid, okay. And few of them actually got some viral fevers, which ran for more than 10, 15 days, really. Now, lately, we are also seeing a term called as black fungus, okay. So now people are really wondering that, when they are getting cured or get rid of COVID, from where are these complications coming? And, if you take a total look, so COVID plus these problems are taking up nice 2 months plus for them to get back to normal. Okay. So what do you, want to tell people on the call that what exactly is this post-COVID?
Ketro, you want to start?
Yeah, I can. Basically, each and every viral infection attacks all organs and systems of our body. Okay, some organs may be affected more, some organs may be affected less, but it happens. But as COVID, the SARS-CoV-2 virus, it's a novel virus, and we don't have any kind of herd immunity, so it's affecting it in a major way. And so it's not that it is only affecting lung. We know it is affecting lung, but at the same time, it affects our neurological system, our gastrointestinal system, after musculoskeletal system, actually all systems. And that is, and even the cardiac systems, it's a major, not only the cardiovascular, the clotting factor, we know, but it is also producing the carditis, cardiomyopathy, etc., during acute COVID. And in many cases, in the post-COVID situation, after the patient recovers from COVID, it persists. It persists sometimes clinically, sometimes subclinically. So symptomatically, the patient may suffer from those things, and we should treat them accordingly. At the same time, some patients may having some problems subclinically. That may means they are not getting it. They don't have any symptoms for that. And for that also, we should take some steps. Suppose somebody after getting recovered from COVID, if somebody has to start sports activity or exercise, he or she should wait for another 14 days. And if there is no problem, then he or she should gradually do it under supervision, step in a stepwise manner. Because otherwise, there may be a chance of sudden cardiac death also. Okay, sometimes. So, we are doing many kinds of investigations to rule out the affection of different systems during COVID. So these are the long COVID. Sometimes there is one terminology is there that is called long COVID, and we should also address that. This is not the today's discussion. Our time will not permit to discuss it in length, but this is in nutshell. And I think Jayanto and Priyanka can add something.
Yes, you have summarized it. I mean, once COVID hits your body, we divide it into different areas. One is the direct effect of the virus into your body. One is the immunological effect of the virus. Third is sometimes the virus affects your coagulation system. So the main symptom is not due to the infection, but due to formation of thrombus at different body, including your lung and other areas. We have seen a lot of COVID patients with stroke, young stroke without any risk factor. They came with the COVID and a big stroke. So COVID can alter your coagulation system. And lastly, as he has mentioned, this long COVID can be of any of these, or your altered immune system makes your body vulnerable to different infections, which are normally, as you already mentioned, this black fungus thing. So we'll come to that later on. But these are the many ways this disease affects the body and how your system copes with that. That is very important. So someone with a very robust immune system doesn't mean then that they will be all right. Rather, it can be the other way around. They can mount such a vigorous immune reaction against the virus. The fight is so tough that someone is sending a nuke to your country and you hit the nuke at the middle of your country, so you get exposed to it. So something like that. So immunity helps us, but at times it's counterproductive. So this is where the treatment is important, because when you see there is a hyper immune response starting, this is the time the treatment should be started properly, so that you tone down the hyperimmune system. Before that, damages other organs, this hyperimmune system. So this is where the steroid and other immunosuppression drugs are important. This is where anticoagulations are important. We have seen patients who are coming back to us with thrombotic complications. After the COVID is cured, they are COVID negative for quite some time, coming to us with thrombotic complications. So this is how it can unfold many ways. Don't get scared.
So that was, a very vivid description, but a very, I would say, tough reality. Also, how bad can COVID get even after you are COVID negative, right? And that's why I think, Khetrada said that, it's important to get well first and then slowly start your regime to get fitter. But I think this post-COVID challenge seems, very, very, dark in my mind. Yeah.
And the most important treatment in the asymptomatic COVID or the mild symptomatic COVID is rest. Proper physical and mental rest, because physical and mental exertion can actually increase the replication of the virus, as well as it can initiate the hyper-inflammatory response. So that is the most important thing, along with balanced and nutritious diet and proper intake of water.
Right.
Sure, Khetrada. I think you have wonderfully explained. Jayantoda, I think one of the most detailed described part. I think this itself should tell us that, once COVID is over, the battle is not even half won. I think the tricky part is yet to come. Okay. And unless somebody gets cured fully, they should not venture out, or they should not take it lightly, because that's the more trickier part. Thank you so much, Jayantoda and Khetrada, for explaining that. Wonderful. Okay, great.
Welcome.
Yeah. So next, black fungus, right? Dr. Jayanto, you said, you will talk about it, right?
Yes.
You open up this 9 p.m. news, and what happens is that, in even Kerala, in Mumbai, and in Delhi, these three places, I know it has been declared as as an epidemic. Okay. It is, spreading by huge proportions. Okay. And it is directly associated with COVID in some sense of terms, is what news channels are reporting, right? So please educate the participants and the listeners on what black fungus really is, what causes it, and how we can safeguard ourselves, please.
Okay. Khetra, you want to start?
Yeah, I can.
Yes.
First, I would like to clear two misconceptions. Number one, it is epidemic. It has been declared epidemic in states, but that doesn't mean it is contagious. So it will not spread from one person to another, one patient to another. Number two is it is not black fungus, actually. This is a misnomer. This is mucormycosis. Okay, this is an opportunistic fungus, and this is not something new. This is not a novel fungus kind of thing. This fungus is always there in our surroundings, in our atmosphere, especially on the decaying organic matters. And the spores are already present in aerosols, and we often inhale it by breathing it inside through our nose, through our mouth, but it rarely causes disease because this is an opportunistic infection. So what are the opportunities? Some opportunities they take to infect us, to produce disease. Number one, diabetes, especially with uncontrolled blood sugar. Number two, any kind of immune suppression. be it HIV or AIDS, or maybe use of steroids. Some patients who is taking steroids, steroid itself causes immune suppression, or some other diseases are there, other conditions are there. I'm not going into detail of this. So the COVID itself in the acute stage and in the subacute stage itself causes immune suppression. Many COVID patients are diabetic, and in the any acute condition predisposes them for uncontrolled sugar, and that itself can cause mucormycosis opportunity, can create opportunity for mucormycosis, that fungus. And at the same time, many patients are treated with steroid. And I know steroid itself causes immunosuppression on the one hand, and it increases blood sugar on the other hand. So this COVID with steroid, with the hyperglycemia is creating a very, very good opportunity for this fungus to attack and create the disease. And these are the intrinsic factors. Another intrinsic factor is nowadays they are thinking that as this fungus grows more on a zinc medium, and there are certain other factors also. I'm not going into details of enzymes and all those things. So it has been postulated that as people are taking huge quantity of zinc for prevention and also for treatment in asymptomatic COVID and mild symptomatic COVID, this may create another opportunity. So these are the intrinsic factors. Some extrinsic factors are also postulated. Those are unclean, not properly sterile, nasal cannula, mask, the oxyflometer, even the water, which is through which the oxygen is passed, that is not regularly changed and cleaned, especially in our country. And this is a huge rush, in the time of huge rush. And also, it has been noted that around 60% of mucormycosis patients are neither hospitalized nor given steroid. So nowadays, it has been also thought that today one paper has come. This is a postulation. It is not yet evidence-based, but there is enough evidence to believe it that the nasal swab, which is being used for collecting sample from your nose during the RT-PCR test, is causing this mucormycosis, giving the mucormycosis spore inside the nose, and after getting COVID, they're getting that. So some extrinsic factors are also there. We have to think of that. So right now, we should treat patient judiciously to control the sugar, to give judicious steroid. Steroid should never be, as Dr. Jayanto has already clarified this, emphasized this, that steroid should be given judiciously and only by doctor's prescription only, under supervision of doctors. That should be done. And at the same time, we should think of the cleanliness and sterilization of these apparatus, etc.
And another good thing I should add with all this, what Ketra has told, that mucormycosis, even we detect in time, it's not always so fatal as has already been portrayed. So it's early treatment of mucormycosis. We have effective drugs available, initially intravenous, and later on maybe oral medications are also prescribed. So it's not that dangerous all the time. Yes, late diagnosis is always problematic. We have encountered this mucormycosis earlier in other situations, other scenario, but this time we are seeing in more in numbers. So Ritesh, we have Dr. Subroto Noskar, who has joined us as an expert in psychiatry. So he will be talking about these mental health problems we are encountering during this COVID epidemic. He just finished another meeting. He is a busy person. So thank you, Subroto. Welcome to our session. This is actually a session which has involved all the residents of my society, the Sherwood Estate in Narendrapur. Dr. Subroto Noskar is a senior consultant in psychiatry at Institute of Neurosciences, Kolkata. my esteemed colleague. So can we request
Yes.
Subrata
Yes.
to tell us about his experience of getting patients who are coming to our outpatient clinic with different kinds of mental disorders which is related to COVID, and his advice as a whole to us to keep our mental health in a better shape in these days. Subrata, please.
Yes. And Dr. Subrata, just to add a bit more color to what Jayantoda said, right? So there are two categories, right? One is, people who have gone through this COVID part and, faced complications and challenges and, survived one. And otherwise, because, so much of lockdown has happened, we are contained into our houses for now last 1 year, right? It has seriously, dented our zeal, our spark, if you will, right? So these are two categories. And, I think participants will be very happy to hear from you how you as a practitioner of the mental health have recommendations for them. Yes, please.
Thank you, Dr. Jayanto sir, for having me, and thank you, Mr. Ritesh. That's a very good question. Some things I will like to mention over here that, as we know that COVID-19 pandemic has wreaked havoc in our life, in our everyday life. So for these various surveys have been done recently to see that how much mental health of the common people have been affected, and you'll be surprised to know that most of the surveys have come up with these statistics of that 70% of the total population, be it worldwide or be it in India, 70% of the population have been affected in some way or the other. Now, if we divide the total number of people affected by COVID, we get two broad categories. First of all, who are currently suffering from COVID, who have been just detected COVID or is going through the symptoms currently, and another group of another group of people who have recovered from COVID or never developed COVID. So there are these two broad categories. Now, I will come to the first category first. That is the patient who have recently developed COVID. Now, in these particular group of patients, we are finding some specific symptoms, mainly anxiety with panic attacks. Okay. Now, I will just elaborate a bit what is a panic attack, because many people, confuse it with a simple anxiety. Panic attack is not simple anxiety. It's just an episode which lasts for 15 to 20 seconds, and where a person feels that, the person, there is too much of palpitation, there is too much sweating. The person feel like he's probably going to die at this moment. So immediately a person says that I'm COVID positive. Suddenly this can happen. Or during the course of the illness, when he is finding himself that his symptoms are aggravating day by day, this can start and this can happen again and again. So that is one thing that we are finding mostly in patients who have been just diagnosed COVID or is going through the symptoms of COVID. Now, as days progress and we go past the 14 days period, then certain other symptoms gradually develop that we are finding. Some of the patients are developing depression. Let me clarify about depression a bit. Depression is not just simple low mood. Low mood, like I'm having a bit of sadness for 1 or 2 days, that is not depression. Depression is a clinical syndrome for which symptoms have to be present for a minimum period of 14 days. That is why I'm saying that after developing COVID, it has to be a period of 14 days, beyond which if we are finding these symptoms, we can say that the person is having depression. What are those? Mainly, the person will have persistent low mood. The person will not have any kind of zeal, as you mentioned, any kind of zeal, any kind of positivity about anything. Whatever he used to enjoy previously, he is finding currently, I'm not able to enjoy that. Certain other kind of symptoms like lack of appetite, lack of sleep, other symptoms such as lack of energy, these might come alongside. So depression and anxiety are certain things that we are finding in most of these patients. Now, coming to the particular group who have probably not developed COVID or have recovered from COVID. In this group of patients, we are also finding cases where there are panic attacks, but the incidences are very less. Depression is quite significant in those group of people because many of them are economically affected, as well as they are also affected not only economically but also because of the fact that they have been locked down in a place for a long period of time. This kind of stress is also changing their mental health status. Another point I just want to add, I think Dr. Roy will also agree, that we are finding that many of the people who have come back from hospital after taking treatment for COVID, they are developing suddenly some psychiatric problems. Why this is happening? This is not, it is not just because the person is just only going through stress. Many of these people are, being treated with steroid. Now, steroid is something that is given in patients who are having serious symptoms, and we do find, when a person is treated with steroid, he might develop some kind of psychiatric problem. It can be depression, it can be anxiety, or even psychosis. So, what is psychosis? I will just briefly mention. Psychosis is a state of mind where the person will have certain symptoms like hallucination and delusion. Okay. So what is hallucination? Hallucination is a kind of false belief that something is happening, something is probably been done behind him, or something he strongly believes in, which is absolutely not true. And hallucination, most of us know, is that a person may hear something or see something that is actually not there. So these two symptoms that we are often finding in people, and in cases of elderly, we may not find these symptoms very typically, but we are finding a bit of very much irritability in them. So it's very difficult to control that at home. And those symptoms gradually die down with when the steroids have been withdrawn and all that. But some of the lingering symptoms still persist. So what can be? So these are certain symptoms that we are finding. So depression, anxiety, psychosis, panic attacks, we are finding day in and day out. So the elderly population are being, elderly as well as the adults are being affected because of that. But another group who are affected very much by this pandemic and also because of this lockdown are the kids, the children. They it has been found that there was a survey done recently, and when they are asked about that what is the most stressful things they are experiencing day by day, in their day-to-day life, most of the kids and adolescents answered those are the online classes. Okay. Now, these online classes, yes, absolutely, it is required for their academic improvement, But these online classes every day, to which they were never accustomed previously, they have to go through that every day, and this is actually taking a toll on their mental health. Now, children, they cannot actually express their symptoms very clearly as we do. We can say that, I'm not feeling okay, I'm feeling low, I'm having this problem, that. No, children can do that. What they do is that we will find the change in them through their behaviors. So either they are getting very irritated, it's getting very difficult to control them at home. Sometimes they are doing some things which it's not like them. Okay, so these are the certain things that we are finding in children. Also, I would like to mention here, even if the person, like when we mention depression, in case of adults, we find that in depressed patients are mainly, their mood is low, their energy is low and all that. In children, it's not like that. In children, depression may be manifested in the form of agitation. So what to do actually? Now, the question lies that what we should do to get ourselves out of this situation. I will come to the certain things that I tell my patients according to the age group. First, let us come to the children. Since online classes, as mentioned previously, is one of the very important stress factor for them, but is an essential thing also that they have to go through in their day-to-day life for their academic thing. It is very important to cut down their non-essential screen time. That means, what is non-essential screen time? That means that what is essential is probably their academic thing. But apart from that, for their entertainment purpose, if we give them, you take the tablet and use them for, for the time that you used to do previously, we can't do that. We have to cut it down to minimum as possible. That is very important time. So cutting down of non-essential screen time is number one. Number two is that to engage them, to make a certain schedule in their lives and to include a lot of games into that. Okay, to make things fun for them. Okay, it shouldn't always be a tab or a computer to get some fun out of it. It should be some games. We used to play Ludo, Carom, and all those things previously, and it is actually a good fun. So it is not only a kind of entertainment and therapy for the children, but also for the adults. Okay, so that is also to include a lot of games in that, number 2, and also to engage them into life activities like, gardening, or, you just can provide them with a pot, with a plant in it. And you tell them that, this is your responsibility. From this day onwards, the plant is your responsibility. You have to take care of them, of this particular plant. You have to water them, and you do that. So maybe a plant, maybe a fish in a bowl or something. This works greatly with the child. So these things are very important, and spending quality time with your child. What does quality time means? Quality time means that there is only your child and yourself. Nothing else exists. That means that when you're spending time with your child, you are getting calls from here and there. You're answering them, not paying that much attention to your kid. It doesn't mean anything. So quality time should last at least 30 minutes to 1 hour. I think everybody of us can get that time from our life for our children. Okay. And if we can actually use that time and, interact with our child, just talk with them, it helps a great deal. Okay. So I think these are certain things that we often advise to the parents that they can actually do to take care of the mental health that actually helps in improving the mental health of the children. Apart from that, if they're finding that if the parents are finding that something else is happening, which is not very much normal, and they're not able, even after doing all these things, they are not able to, see an improvement in the child's actions, behavior. I think in that case, they should consult with a therapist or a psychiatrist. And if something else is happening, if some certain times medications can help or therapy can help. Now, coming to the point of adults. Adults have been affected also greatly because many of them has lost their job. Maybe many of them have a serious lifestyle change, like suddenly from working in an office coming down to a work from home situation, losing touch with their peer groups totally, just only video calls, which is actually nothing. Social interaction. We all humans are social beings, and this human interaction, it means a lot. Okay, so when that is not happening, we are definitely feeling ourselves that we are not like what we used to be like 2 years back. Often we are constantly burdened with this anxiety that probably I'm going to get COVID, or maybe my elderly parents are going to get it or something. So to get out of this particular feeling, what we can do is, like the children, we have to engage ourselves. We have to use our thought process into actions which not only help us to I will say that to divert our attention from these incidents that we are hearing every day, but also it will also help us to improve our total quality as a human. Like say that, let's say that me as a adolescent maybe, or as a child, I used to learn, I thought that probably I would learn a particular skill, maybe, learn guitar or something, or anything. So we can use this time when we are sitting at home to, there are online classes available for any kind of developing skills. So we can actually engage into one of those activities, learn a new skill. Okay. And, maybe practice the guitar a bit. Okay. So, participating into new activities, apart from what we are doing day to day, and honing some skills, it gives us a sense of self improvement, a sense of self confidence that also helps a lot. Second thing I will say that we should keep ourselves away from social media and these media channels as much as possible, except from these national news once only a day is sufficient, I think, because the news channels, what I find are they are competing against each other to give us these tales of what is horrible going on around us. Nothing positive, I think, is whatever they are delivering. I find nothing positive in them. So it is very important that we minimize our media exposure. Okay, that will definitely, I think, help us a lot. Okay, that is number 2, I will say. And number 3, I will say that our body is connected to our mind, right? So if there is a good physical health, the mental health is also going to be better. So it is important that we take care of our physical health also. We know that when we do a bit of exercise, our body releases endorphin. There is a chemical called endorphin. Now, these endorphins are natural mood stabilizers. We feel good when we exercise. After you ask any person who goes to gym regularly, they will say that after sometimes if I stop going to gym, I'm not feeling okay. Why? Because he's missing that endorphin. It is something very much addictive. So it also helps us to improve our mood, right? So it is important that if we do exercise regularly, our physical health will improve as well as our mental health is also going to improve at the same time. So this is something I will suggest for the adult population in general, for keeping our mental health in a good place. Now comes the elderly population. Now this is a very tricky area because most of the elderly population who are staying over here, I find that many of them are having very poor social support. Many of them are having kids who are eager to help them, but they're not here. They're in a distant state or maybe in a distant country. So they are calling now and then, trying to get information about their parents. But this is not everything. This is not all. Because when their kids are calling them, they are just saying, they're telling them that, I'm fine, I'm doing okay and all that. But they are coming to me and saying that, doctor, I'm not able to express their feeling. Because if I tell them I'm not okay, they are probably going to come down all the way from there. And I don't want them to come over here with all these problems going on and all that. So the thing is that it's very difficult to understand and they're coming to me when they're in real distress. They're having some real issues. So what we definitely feel is that there is a serious mental health issue going on in the elderly population, which we not only as a family member, but also as a neighbor also need to take care of. Now, since it's a residential meet, I think many of the residents are over here and they're definitely probably will find some information from whatever I'm telling them. So it's also duty of us as a neighbor also to take care of our neighbors. As a human, we need to take care of another human. So if we find that, there is an elderly couple nearby, we need, and passing by when we meet them in the stairs or in the garden or in the outside, we just just a simple question, okay, ma'am or sir, how are you? That simple question, that one question will give a plethora of information. Okay, you just ask that person, okay, sir, how are you? The person will definitely tell you that what is going on in your mind. If the person wants to express, definitely. That's a very important question. How are you? How are you doing? Just a simple question, but it gives a plethora of information. And if you after talking to that person, find that, probably what you knew about the person previously and what you are getting currently is not something which is normal, you definitely should, talk a bit to that person over the phone maybe, or you may inform the family members of the person that I think that probably, your mother or your aunt or your father, he needs some help. Or if it is possible, I know it's not possible for everybody, but if it is possible for you as a neighbor also, sometimes, a call from you that, we just talked the other day and you were saying that you are not okay. How are you doing? Are you okay? And all that. If you still find that the person is having a persistent problem, I think that in that case, you should suggest any therapist or a psychiatrist so that that person can help that person out. And in that case also, I will suggest that to utilize the elderly population also in our community activities, because most of us, what we have is a kind of, this is called expressed emotion, negative expressed emotion. What is that? That means is that the person is old, he probably won't be able to do anything. So let him, okay, I will do that for you. This is not okay. That kinds of dips the person's sense of self-respect. Okay. So what is that? If it is possible as a community, if you are doing certain activities, okay, simple activities, okay, it is important to include those elderly people. Okay. So it is important to get rid of this negative expressed emotion. So I think that as a community, you definitely can help. We definitely can help these people. And at the end, I think that some of the mental health issues that we are facing day to day will pass away gradually if we can support each other. But all the mental health issues just will not, go away just like that. Some of the mental health issues, most of the mental health issues that occurs are just not an initial stress reaction only, which can be overcome very easily. Many of them causes neurochemical changes in our brain, and these changes becomes permanent if not treated with medications. Okay. So again, I'm saying that if anybody in your family, even yourself or in your neighborhood, if you find that somebody is suffering from any kind of mental health issues, it's very important to motivate them to go to a doctor, a psychiatrist probably. Why I'm saying that to motivate, because there is a stigma in our society about psychiatric illness. If I say to anybody of you probably that, I think that you are having this problem, you should go to a psychiatrist, the person may get offended. Okay. So it's very important to counsel them. Okay. That I think, is having some issues. I think you can discuss that. First, try to discuss that, just you can discuss that with that person. And after certain times, you can motivate them. I think that you need help probably. You just go to a doctor, I know, okay, and probably that is going to help you. And if you definitely, counsel them properly, the person is definitely going to come. So I think that I have given some relevant points over here in a however short way is possible for me. I think it helped. Thank you.
Thank you, Subrata. Thank you so much for this excellent. The outlook of the whole thing in this current scenario, and that will definitely help all of us. Thank you so much.
Thank you, sir.
Yeah, before you hang out, okay. Just to tell you, while you were talking on COVID, mental fatigue, and post-COVID, and then these three categories: children, and then middle-aged, and then elderly. I have made 3 pages of notes, okay, because I think it is. I think one of the most valuable advices, very informative I've ever heard. So really, thank you for that. And I think like me, there are many other listeners who have got immensely benefited from it. So thank you so much for that.
Thanks, Subrata. Thanks for your time.
Thank you.
Thank you, Subrata. Great. Good. Jayantoda, so, now we have got a COVID warrior joining us, and it is my pleasure to introduce him. There is just one last question, which people have asked more than one. But before that, it's my pleasure to, invite Rajkumar Udani. So Rajkumar Da is a very senior IT leader in the IT community, in one of the Fortune companies. A sportsman by nature, but, because of the pandemic spread, he got infected, and he was in ICU. And I have seen his journey from getting infected to getting cured, and then motivating people what to do, what not to do in COVID, right? From being the, I would say, infected person himself, okay? So Rajkumar Da, welcome to the call. I'm sure, your experience, your journey from COVID and getting infected and recovery will be a great story for people to listen to, do's and don'ts. But Rajkumar Da, give us a minute. There is one just question which is sort of popping up, and I'll ask that to Jayantoda. So Jayantoda, the last question, but multiple people have asked it. Third wave of COVID, and will life be anytime normal in the future?
Should I take the question after Rajkumar says his story?
Absolutely. Because we want to hear a positive answer that, yes, it will be fine, it will be happy. We will live ever happily afterwards. So Rajkumar Da, over to you.
So Rajkumar, please.
Yeah. Thank you, Ritesh. Thank you, Dr. Roy. Good evening to everybody. First of all, I would like to express my thanks for giving me this forum on the platform to share my story. As Ritesh already explained, I went through this the situation late last year, and I've come out of this. But what I want to really do is basically, just share essentially a sequence of events that led with what I experienced through the illness itself, right? And most importantly, something that I basically learned, and as advised by a doctor, post-COVID, right? This is one area that I've seen significantly. A lot of the people who have got infected, that they have neglected a lot of the post-COVID period, right? And there is some of the lessons learned from my own experience. I want to talk about it. That what is I did essentially to ensure that my recovery was as scheduled and as planned, right? Because I did go through a pretty severe load of COVID when I was infected, right? And some of the basic lessons learned, right? Again, I think there is a lot of information that all the esteemed doctors have shared here. So probably nothing more for me to add per se, but just share my perspective of lessons, just like somebody who is not a really a medical person, but what I felt that I needed to do. So for all the the people who are attending this, wanted to just share my experience, right? So let me get started, right? So as Ritesh, before I just jump into this, as Ritesh said, I'm a assistant vice president with Cognizant Technology Solutions. It's an American-based IT services company, and I stay with my wife and my 12-year-old daughter in Upahar. Essentially, it's again a gated community like Sherwood, near New Gadia station. So the whole thing started, right, just after the pujas last year, right? It was, I remember, a Sunday essentially just after puja. And essentially we had like every puja, right? Our family used to have, a dinner on one of the days on Ashtami or Navami, right? So we went to a five-star joint thinking that, it will have all the COVID protocols that they did have, right? So we had lunch there. And that from the next day onwards, right, that was on a Sunday, I started having very strong indigestion and basically started developing fever, right? And I had a bout of vomiting, and I was feeling very, very heavy with my stomach, and had absolutely very sharp pain on the headache, right? Uh, so what happened is that we first thought that let us see for a day, because I have a bit of a history of indigestion. We take some medication and see whether it turns out well or not, right? But this persisted on Monday. So what we did on first thing we did on Tuesday, we did a teleconsulting with one of our physicians whom we know. And essentially, what he advised was this, that given some of the symptoms looked familiar, he advised us to get tested. And essentially, he provided some general medicine in terms of taking care of the fever and some of the indigestion that I had, right? And said, let us wait for the report before we can do any further treatment, right? So all along this period, I kept basically checking the saturation levels, which was constantly about 95, 96. My breathing problem was, I did not have any breathing problems per se, but yes, I was losing my taste of food. My food intake had dramatically gone down, right? So we got ourselves tested on a Thursday, and by Friday, and I waited that, when once the report comes in, probably if you believe that I am COVID positive, then probably we'll think about hospitalization. But so far, we were, quarantining at home. One of the good decisions we took in the Sunday itself, when the first symptoms started to appear, my in-laws stay is very close by. So we sent our daughter to stay with our in-laws to make sure that, she is not exposed at all. So just me and my wife are basically isolated at home. On Friday, from afternoon onwards, is where my saturation started to go down. And by evening, it dropped below 90. And that is where, we felt that this is probably not wise to sort of stay at home. So we consulted some of the doctors in our complex, and they also advised that, to do a hospitalization. And I had started to develop mild breathing problems, but not very acute. So we basically called an ambulance. We went to RN Tagore. Thankfully, we got a bed, and I got admitted. I was in ICU for 9 days, and even though I did not realize it myself when I was there, but for first 4 or 5 days, I was slightly critical in the sense that a lot of my parameters were very high. The RT-PCR test that came along, my CT value was 18, and my D-dimer load was almost to 17, almost 1800, which is extremely high, as I understood. So essentially, from the day one, I was put on 14 liters of oxygen support, and for 9 days I was in ICU. For first 4 or 5 days, a lot of my other parameters also went up because I have other things like hypertension. I'm also CKD stage 2 patient as well. So basically, doctors were trying to do multiple kind of treatment to make sure that these parameters are brought under control before they could do further treatment. Thankfully, after 4 or 5 days, some of these parameters came under control, and they were able to do the further treatment. And slowly they started to reduce my oxygen support from 14 to 12, and then 12 to 10, and to 10. It came down, right? On the 9th and the 10th day, I was finally shifted to a normal bed. And basically, with by this period, I was pretty desperate to go home. So I kept telling doctor that can you please send me home? I think I'm feeling better now. He told me very clearly that, look, Mr. Rodani, I know that you are getting better, but I would like to ensure that you are without oxygen support for at least 2 days. We want to see that your saturation levels are staying steady. You are able to operate without having any oxygen support, because it is very difficult that if we send you home and you again develop some complications, it will again very difficult to get you back and get the treatment start again, right? So please be patient. So one of the lessons I learned, patience is the key.
Yes.
It's very, very important, right? And you cannot challenge this. There is no other way. And listen to the doctor. Extremely important. Okay, whether you like it or not, it is very, very important. Take his word as the gospel. Okay, so finally on 14 days, and in fact, By 12th day, finally they took out, took him oxygen support, and I was also given a physiotherapy to see whether a little bit of walking was almost for 12, 13 days was bedridden, right? So basically, they measured my saturation after a small walk with the aided support, and they basically measured my saturation to see whether it was how it was, and it was staying up, right? So they monitored for 2 more days. On 14th day, just before the Diwali, I remember Saturday was Diwali, and Friday, doctor signed my discharge paper. But when I was discharged, one very important message delivered to me, and this is something I want to share with everybody. Please do not think COVID is a 14-day phenomenon, especially for people who are strongly infected. It is a much longer phenomenon. Your virus may go away from your body, but it will leave you very, very weak from an immunity perspective, right? And this post-COVID is an extremely important part. And there is something doctor advised me that, Mr. Odani, a lot of people do not know. We do not have a lot of historical data, but I can tell you, and what we are finding increasingly is that if you are not careful, after you go home, you can have multiple other stuff. Yes, you cannot get infected again by COVID-19. You cannot infect somebody with COVID-19, but you definitely can have complications like fibrosis. You can get pneumonia. There are other complications that could set in, especially winter was setting in. So it was very important for me that at least once I go home, I should stay isolated. When I say isolated means stay at home. Don't roam around too much. Stay in the home environment for at least 2 to 3 weeks, and do not step out of home for at least 6 weeks. That was an express instruction, because there is every possibility that even if I were to step out of home for a short period of time, there is every possibility of getting infection. So essentially, he warned me that this is something very extremely important, and I should pay heed. Other thing, what I was asking him that, given that in typically if an IT company, this is the time where a lot of the business planning for next year happens, and the unit that I had essentially there were a lot of these activities going on. So I asked doctor, how can I very quickly go back to work? His express advice was, please do not touch your laptop for another 2 weeks. And once you start to get back, please do in a staggered manner. Do not jump to get your 9-hour, 10-hour, 12-hour shift immediately. That would be very, very counterproductive, right? And thankfully, I did listen to him. Though I remember, I think the third or fourth week after I came back, I felt bit arrogant, I would say. So let me try and push myself. I took 2 or 3 back-to-back calls. I can tell you, I had to sleep the whole next day, almost lie down to recover myself. So lesson learned, right? And make sure that I completely staggered my work. I can tell you, it took me almost 5 to 6 weeks to get back to almost kind of normal work day, but that also without stress. Other thing I was listening what the earlier doctor was saying, very, very important. Stress, extremely important, right? Please stay away from stress as much as possible. I know in modern life it is impossible to stay away from stress, work-related stress, other-related stress, especially if you are confined to home for such a long time, right? But it's very important that your family supports you. They keep you completely stress-free, and make sure that you rest a lot, eat well, eat protein-rich food. Extremely important to get your strength back, and make sure that stay away from stress, because that can lead to a lot of complications. And as I said, right, it took me about six weeks to 8 weeks to get back. And then essentially, when I had my first visit to the doctor over a teleconsulting, of course, when I showed him, basically, he said that I still need to kind of stay in this restricted lifestyle for another month or so before I get back to full, kind of full normal working style, or the style that I was having before I hit was COVID, right? So it took me almost 3 months of recovery. I had to be patient. I had to be, as take away as much stress as possible, and I had to, stagger my work. Okay, so what few lessons learned, I would say. One, throughout your period that you do, please stay under supervision of doctor. I have seen quite a few of my colleagues who have done some home treatment, have not consulted doctor, tried some prescription medicine on their own. Please do not do that. Okay. From day one, one of the things that I did essentially with a medical doctor, right? Very, very important. Please do not do your own stuff, right? Second thing, patience is very, very important. And Ritesh knows I, at least on a work-wise, a very impatient person. It's very difficult for me to make a decision. This is the first time in my life I've been away from work for this long. And I have not taken a medical leave for last 13 years. For last 13 years in my career, I've not taken a single medical leave. Okay. So it was very impossible for me to stay from work for almost 4 weeks, but I had no choice, and I had to learn to be patient. So this is very important. Stress, extremely important that your family supports you. You stay away from negativity. Stay away from a lot of TV channels. I don't know name specific channels, but please stay away from that. And please stay away from a lot of YouTube. All the desi totkas that you will see. Please stay away from that. There is no scientific evidence. Please do not follow those. Okay. Please stay under the advice of the doctor. That's very important. And I personally would like to thank my doctor who was there in RN Tagore, Dr. Sujan Bardhan, a fantastic, not only a great doctor, but even a better human being. I can tell you, it is only after I came back that I knew how critical I was. Throughout the 14 days that he saw me with a smiling face. And in very nice way, he used to explain to me what is going on, right? I never felt that I was critical. And that is a complete credit to the doctor as how he was able to stay composed and keep me in good humor, keep me away from stress, right? So my sincere my appreciation, I'm very thankful, and for a lot of the active advice that he gave me, especially post COVID, how to ensure that period is well covered, well looked after, right? So as I said, I'm not a medical practitioner. There are extremely esteemed doctors here who have already covered this, so nothing to do. But I'm just saying, as a person who's gone through a very difficult period, I completely understand, appreciate what all the esteemed doctors have shared here, right? And if you follow this, there is no reason for any of us to be afraid. Okay, this is something that we can easily overcome if you do the right treatment at the right time, be on the right doctors. Make sure that you do your part, be patient, stay away from stress, and follow the the prescriptions and the advice the doctors are giving, and importantly, your family support. I remember my wife, who was, by the way, also COVID positive but completely asymptomatic, and she spent entire 10 days in quarantine while I was in hospital. So I can imagine the steps she had to go through as well, right? But that support was extremely important, right? She stayed firm, and we were able to kind of overcome this very difficult period, I would say, right? But as I said, right, I've gone through a very difficult period. But if I come to think of it, I feel I'm very fortunate that I'm here still in a I would say unhealthy situation, able to share my experience with you. And I do believe that with the right human spirit that we have, the collective spirit that we have of the society, I think we can overcome this pandemic. It's just a matter of time, I believe. We have to stay safe. We have to follow the social distancing protocols. If double mask, if you have to go out, right? Uh, Wash your hands, sanitize your hands, right? But don't fear. Let us not fear. Let us be careful. That's my parting message. Thank you.
Thank you, Mr. Wadani. I think nothing can be better than this. I mean, hearing from a horse's mouth, and you gave the right advice. That is very appropriate. That dealing with the disease and getting a right advice at the right moment, which is the
Absolutely.
most important part in COVID.
Absolutely.
COVID, yes, we know that some percentage of COVID, they can develop some complications, some difficulties, but listening to the doctor at the right time, getting the right advice and following it to the T is very important. And this has actually helped Rajkumar and everybody. So I think this is a very important message you delivered today. That will help everyone actually.
And another message he has given, very important, the keeping patience and keeping mental
Faith
calm. Keeping patience, faith, and mental calm.
Yes, that is very important.
Yeah.
Very important. Thank you
we
so
shall
much.
overcome. And we shall overcome. I'm
Yes,
sure of
we shall
Yes.
overcome.
Yes.
Certainly. And Rajkumar, your story is a story of courage. It gives us a lot of strength, right? And I think, we are so happy to hear this vivid description of, what did you do? How did you pass through this difficult phase? I think very, very valuable lessons for all of us, all the people here. So Rajkumar, sincerely, thank you for taking out time and talking to, all the listeners here. Thank you so much.
Thank you.
Sure. Thank you, Rajkumar. So Jayantada, we are coming towards the almost end of the session. The last question, which people are having, will this ever end? And will there be a third wave? We are already talking about that, right?
Well, I think we already know a third wave might be coming, will be probably coming. So we have to prepare for that, because these kind of pandemics, if you learn from the history, they come back in a different way. They come with new mutations, and we human beings, we have to learn how to deal with that, how to live with that, and how to combat that over the time. So we are learning every time, and most important is whatever number of wave comes, other than vaccinating ourselves, protecting ourselves, the basic should not be forgotten. The basic is your protection gears. This is actually is going to help you in the long run in any number of waves coming in future. So your basics, like with Dr. Khetromada will be again emphasizing on that, using a mask properly, hand hygiene, distancing. This is very important. And yes, if we get vaccinated, maybe the third wave will have a lesser impact on us. We're not sure, very sure. We might be having more helpful medications in future. So, and we have to protect our younger generation from the next wave. This is another concern for us. But yes, universal, adoption of protective measures actually help you in the long run. This is the message in brief. But and after I finish, actually, Ritesh, I have another meeting at 8 o'clock, as I told you. So maybe I'll not be able to continue with the session further. And I request my colleagues, Javed and Ketro and Priyanka, to continue with the session and wrap up the session with a few more questions left. So if you allow me and my colleagues, so I can log off and join the other meeting.
Jayantada. And Jayantada, you've been always very helpful, very supportive, very forthcoming in terms of, helping residents to get educated so that, we all can collectively safeguard our society and near and dear ones. Jayantada, sincerely appreciate your time, every time. You've been so amazing. So thank you so much, Jayantada, for everything.
Thank you, Jayantada. Thank you.
Bye. Sure.
Okay, thank you so much.
Thank you.
Sure. Welcome.
So Khetromada, I think, the last question now, after wearing masks, also a lot of people are seeing that, they are catching COVID. They say that, they are washing hands and so on and so forth, right? If you can just, talk about to people, we all wear masks, right? It looks pretty straightforward, but people end up in wearing it wrongly and then getting infected. And then they say, you know what, I was wearing masks all the time. Still, I got infection, right? I don't know what to do, right? So anything that you would want to say about that, please, Khetromada?
Yeah, the thing is that there are different kinds of masks, okay? But I just want to highlight three things which can be used in the community. Number one, N95 mask, okay? As I have told, I have kept it here, N95 mask. And while purchasing, this gives the best protection. Forget about N99, that is not for medical use, okay? But it is for use by the medical persons, but it is difficult to wear it long term for the common persons. So if somebody can wear it, nothing better than this. And while purchasing it, they should take that logo, NIOS, SH number, lot number, and TC number. Otherwise, there are many fake masks there. Okay, so we can get cheated. So this is the N95 mask, and I'll just show the proper way to wearing mask. Okay, first you should sanitize your hand. I'm audible?
Yeah.
Not audible. Okay.
You are.
Anna, you are audible.
First,
Yes, you are audible.
Okay, audible. Okay, fine. Then you should hold this on your palm like this. Specs should be removed. Keep it like this, covering the chin and the nose bridge. Now the upper strap should be kept here above the ear, and the lower strap then holding this should be below the layer. If somebody has long untied hair, it should be below the hairline. And after that, with 2 fingers. This metal clip should be used to mold it to the shape of the nose. And after that, we should check for the air seal. If we find that some air is going out from the above, then we should mold it more. And if it is from side, then we should untwist the spring and adjust the string. Then check again, and this is the final way. Okay. And whenever we should take it off, we should not, and then if we have specs, we can wear specs over it, not below it, beneath it, I mean. And during removal, we should again sanitize the hand. I am not going into every details. Then the lower ear should be wiped overhead. Then keeping this, it should be again overhead, and without touching the outer surface, we should, if for the reuse, keep in a zip bag, new. Otherwise, we should discard in a covered dustbin. Okay, so this is the donning and doffing. And the most important thing is that how to wear, how to take off, how to keep it, use and reuse, and how to dispose it. I have shown it. But next best thing which can be worn is the surgical mask. The same way we can use the mask. I'm not going into details again. And for these also, there is a metal clip. Okay, just a minute. And one more thing, people are often get confused with the color of the mask. For the surgical mask, it doesn't have to be green or blue only. It can be of any color. And for identification, the inner side and outer side, the inner side is the lighter side and the outer side is the darker shade. And the metal clip will go above. This is the way, and we should again adjust this like this. But in surgical mask, the protection is not as good as N95. First of all, because the filtration is better in N95 mask. And second, the most important thing is that there are many gaps at the side and also at the above. So we can minimize the gap by molding the metal clip to our nose, but we cannot do it here. For that, there is a new technique, and that technique has been got approved by the CDC study, Center for Disease, that is called knotted ear loops and tucked inside. How can we do it? I'm showing it this. First, you fold mask like this. Then make a knot as close as possible. Both the sides. And then tuck in the sides. And now it becomes a kind of N95. And while the sealing is better, here the sealing is much more better. There is no gap. It looks like N95 mask, so it gives much more protection. But one thing we should remember, that I'm not showing the disposal. Again, we should not touch the outer surface. And each and every time, even after removing the mask, holding the straps, we should sanitize our hand, because we are concerned, because we are thinking that we want to protect our nose and mouth so that virus should not come and go through the nose and mouth. But it's not that if somebody is always speaking from our behind, from our side, left side. So the droplets and aerosols are coming all over. We are actually bathing in the shower of droplets. So while we are touching this, we should sanitize, and we should never put our finger or hand to mouth or nostril without sanitizing our hand. Sometimes we need to eat something, so we should take it off, then sanitize in a secluded place, and then eat. And then after that, we can take it again, wear it. And we should sanitize that place where the outer surface is touching that spot. Otherwise, nothing is complete. Okay, so we should wear this mask. And nowadays, it has been recommended even for common people to wear 2 masks. And it has been found in a study, in a good study, CDC study, that if somebody is wearing a cloth mask over a surgical mask, it gives 95% protection. That means as good as N95 mask. So for common people who are not going to the medical facilities, who are not doctors or paramedics, 1 surgical mask and above that 1 cloth mask is as good as N95 mask, unless and until they touches the outer surface, unless and until they messes with hand sanitizer, etc. And at the same time, there are some confusion about 6 feet distance. Actually, the droplets are ejected from our mouth, and it is going to that direction, and gravitation is pulling it downwards. So if we remember the school physics, we know it will take this kind of movement pathway, and that will settle down in a radius of 6 feet. And the chances of getting infected is minimized to 1 to 2% only when both the persons are wearing masks. At the same time, they are maintaining 6 feet distance. This has to be kept in our mind. In many instances, people think that, okay, he's not wearing mask. Okay, I am not wearing mask. We are keeping a 6 feet distance. That is not enough. That is not at all enough. If both the persons are not wearing mask and keeping a 6 feet distance, that means they are having a chance of 70% disease transmission, the infection transmission, the virus transmission, what I mean. So the mask, proper mask in a proper way, today's recommendation is double mask for everybody, not only for doctors, for everybody, with proper hand sanitization, proper distancing. And I just want to add another point, that we are, by using mask, we are covering just 2 entries, the nose and mouth. We are forgetting about the 3rd entry, the eyes. And for that, it is best to use an eye protector or a face shield. And today I have seen a picture in FB that our Ritesh is taking the COVID shield jab, and he is using mask along with the face shield. So whenever you are going to that kind of community where there are many people and all those, irrespective of specs doesn't cover these places. Okay, so it's always better to use double mask with a face shield, and if that is coupled with physical distancing and the proper hand sanitization, there is nothing better than that. And from the Sherwood point of, I have seen 2 things. Sherwood viewpoint, that many of us are quite reluctant, quite negligent about wearing mask just outside our flat in the lobby. But as it has been proved that this is not only droplet, the aerosol is also very important for the virus propagation, infection, etc., transmission. Our staircase lobby is not at all well ventilated, especially in the time of rainy season, the monsoon. Securities are always shutting the door. So it is an ill-ventilated column where lots of aerosol may be present. And each and every person should be considered as a potential source, because I may be a asymptomatic carrier. Somebody else may be some asymptomatic carrier. So every day we are checking that, oh, flat X, lobby Y, he is positive. Okay, we'll not go there. Otherwise, we are moving freely in our lobby. No. I myself might be asymptomatic carrier, another person might be. So in the lobby, we should take care of that. And we are free to move without mask in our campus while jogging or for the brisk walk. Yeah, that is required. But that should not be taken as a liberty. We should alter that for our own safety. Suppose you are moving under a balcony and somebody is talking from the balcony, the first floor balcony. So while you are passing, no 6 feet, you are actually bathing in the shower of droplets. So while you are passing below that, you should wear the mask. You should keep the mask on. That is my suggestions to my fellow Sherwoodians. I think that is over, and I just want to end this discussion, this part of discussion, with 2 lines from one of my viral rhyme that এখনো সময় আছে বেঁচে যাব সবাই ঠিক মাস্ক ঠিকভাবে সকলের পড়া চাই.
Wonderful. Dr. Khedro, I think that was so nice. And I think, what, I particularly learned, and I'm sure other listeners also, what we do is we go out to the market and then we buy a mask and we simply wear it. But then I think what you told was that, covering this air pockets, from your nose side and from your neck side. I think that's really, really important. Very, very valuable to, I'm sure, everybody, who's listening it. So, Khedro, thank you so much for sharing that insight with us, even though, masks is such a common thing. So I think, we have exceeded time by almost now 20 plus minutes. But in my mind, one of the really amazing and very insightful sessions covering not just COVID part, post-COVID, mental health, mask part, right? Vaccines and whatnot. I think with that, so Dr. Javed, any parting lines from you? Dr. Priyanka Singh, any parting lines from you for our residents?
I just want to brief about today's session. Give things to do in this pandemic. Number 1 is eat well and sleep well. Second one is work well. Third is exercise well. Fourth one is breathe well and do some kinds of breathing exercises, and practice good hygiene like mask, hand sanitization. Sixth one is limit COVID-19 media exposure. Seventh is maintain positive mood. Eighth is don't medicate yourself. Consult your doctors. Vaccinate yourself and encourage others to vaccination. Then give help and take help from others. Don't hesitate in taking help also. Get and provide warm, comforting social supports to others. Stay socially connected by maintaining physical distance. Stay positive and stay safe.
That was lovely, Dr. Priyanka. Yeah, Dr. Javed.
I think very well summarized. Very well, extremely well summarized.
Everything in a nutshell.
The whole thing has been so. It's been a wonderful session. I just want to add just one thing, nothing else. It's just that, we've been talking so much about vaccination. So, it's been confirmed now. Next week, we are having, at least one hospital is definitely having it. Tomorrow, in fact, today evening, Ms. Chandrani will be rolling out the information regarding it. And the second hospital, we are already speaking. So both the hospitals, we intend to have the vaccination to next week. So this is something which I want to tell you. And all the viewers.
Yes, and Dr. Javed, I think that's such a positive news. People are waiting with the bated breath onto when vaccine will come.
Right, and it will be it won't be only 18 to 44. It will be the second dose also. And in fact, we will be having both the vaccines, so there'll be preferences for Covishield as well as Covaxin.
Okay, sure. Wonderful. And I think to the panel of doctors, I believe, residents are really fortunate to have such supporting doctors here, who are always ready to guide people and go out of their way to, help them. So again, one more time, Dr. Priyanka Singh, Dr. Javed, Khedroda, really thank you from my side and on the behalf of all the residents who are listening to this. So guys, I think, we are done with this.
Congratulations to Ritesh for
wonderful
anchoring this. Wonderful anchoring this.
Thank you.
And congratulations to thanks to all the residents who are attending this session.
Thank you.
Thank you so much, everyone.
Thank you.
Thanks.
The recording has stopped.
Thank you, ma'am. Thank you for your valuable time. Recordings, we stopped the recording.
Okay.
সুদীপ সুদীপ আমি করছি, হ্যাঁ, লগ আউট করছি।